So this is about the clinicals related to the joint, and this is the third chapter of BD. Also in this video we will cover the clinical box from KLM. The first one is about sciatica. Sciatica is a condition where the joint between the two vertebrae, it is the secondary cartilaginous joint, and you know from your previous knowledge that in secondary cartilaginous joint there is a fibrous disc in between the two bones, right? So that disc in the vertebra has a gel that is known as nucleus pulposus, right? And that sometimes with age or because of any trauma or pressure, it just protrudes out. That gel slips away from that disc and it goes backwards and it starts irritating the nerves that are emitting from the vertebra in the intervertebral foramina, right? So that irritation of those nerves leads to a pain sensation which radiates into the lower limb, and that is known as sciatica. Next is joint dislocation. So whenever two bones meet, they form a joint, and that joint is like a socket, right? So sometimes a bone slips away from that socket, and if it slips away completely, that is known as a dislocation. But if it slips out partially such that some part of it is still in that joint capsule, that is known as subluxation. So dislocation is complete movement out of the socket, and subluxation is a partial movement out of the socket. So next is rheumatic fever. It is a type of arthritis which is caused by group B streptococci. It is a pathogen, and what happens in rheumatic fever is that it just licks the joints, but it kills the heart, right? So it just only causes inflammation and swelling in the joints, but it does not destroy the joints. Rather, it destroys the heart. So what happens in the joint is that the joints become inflamed and swollen, and that is a feature of rheumatic fever. But the main problem in rheumatic fever is that it affects the mitral valve of the heart. Also, it affects the kidneys, and because of these things, it mostly happens in children, so that child dies because of the heart conditions. Next is rheumatoid arthritis and osteoarthritis. So arthritis is simply the swelling of the joints, the inflammation of the joints. And it is of two major types. One is rheumatoid arthritis and the next is osteoarthritis. Osteoarthritis is because of age, and rheumatoid arthritis is because of autoimmunity. So your immune system kills foreign objects, right? But sometimes it just goes away and it kills, or it starts attacking your own body. So that is rheumatoid arthritis, an example of autoimmune process. And there is inflammation, swelling, and it's a systemic disease. Systemic, why? Because it not only affects the joints but the heart and lungs as well, right? And it's a chronic inflammatory process, and there will be bone erosion. On the other hand, the osteoarthritis is because of the wear and tear that occurs with age, right? And as a person ages, so the cartilage that is in the joint that covers the two bones that are communicating, it just gets destroyed. And when that cartilage vanishes away, so the bones, they come in contact with each other and there's no material left in between them. So they, as a reactionary process, they start growing and they form osteophytes. So this is the difference between osteoarthritis and rheumatoid arthritis, that in both of them, cartilage gets destroyed. But in rheumatoid arthritis, the bone does not form again, right, as a reaction. But in osteoarthritis, they start forming osteophytes. Next, we have a table that is showing osteoarthritis and rheumatoid arthritis. Osteoarthritis, it occurs in middle age and it occurs in the large joints. Remember this, the weight-bearing large joints. And rheumatoid arthritis occurs in small joints of hands and feet, and it involves many joints, multiple joints, right? And osteoarthritis is a degenerative condition, and there the articular cartilage is damaged, and as a result, osteophytes are formed. But in rheumatoid arthritis, it is an inflammation. The synovial membrane gets inflamed. Cartilage is also damaged here, but there is no new bone formation. And the ESR, which is a marker of inflammation, is absent in osteoarthritis because it is not an inflammatory process. Whereas on the other hand, it is raised in cases of rheumatoid arthritis because it is an inflammatory condition. So next is the injuries to the joint. Whenever a joint gets injured, sometimes the menisci which are present inside the joint, they also get injured. If they cannot be repaired, then they need to be removed. And in the coming clinicals, you will see a procedure known as arthroscopy. That is the procedure we use to repair or remove these menisci. And if a joint gets fractured, then blood and broken pieces, they collect in the joint cavity, and if they cannot be repaired, then they have to be replaced, right? So the joint is then replaced. Another thing is that about the viscosity of the synovial fluid. So in the synovial joints there is synovial fluid, and it is there for lubrication, and for lubrication a fluid must be thin. So in winters or in cold weather, this fluid gets thickened, and because of that joints get stiff, right? But as soon as you start moving them fluid, it warms up, and because of that the stiffness gets resolved, right? And the last one is neuropathic joints. So a neuropathic joint is one which has lost its nerve supply, right? So the first thing is that it would not have a pain sensation, and the next is that it would not have proprioception. So a person would not know where he's placing his joint. So as a result of that, there would be excessive mobility. Because of that, there would be damage. It would get swollen, but again, the person would not feel any pain, and the destruction would carry on. And because of that, ultimately he may lose that joint and finally needs to be replaced. And this occurs mainly in people who have diabetes, because in diabetes the nerve supply gets diminished, and also in conditions like leprosy and rabies dorsalis and syringomyelia. These are all conditions where nerve supply is disconnected or discontinued. So next is the clinical box from KLM. The first thing is the joints of newborn cranium. So the bones of skull, the upper part of them is known as the skull cap, and the bones in the skull are connected by sutures. We already know that, and sutures are fibrous type of joints, and in fibrous type of joints, two bones are connected by fibrous tissue, right? And the area between the suture, it is inversely proportional to age. As a person ages, so the sutures, they come close to each other, right? But in newborns they are far apart from each other, and where three or more sutures combine, in those areas there is a lot of space, like more than usual, and that space, that wide area of space, it is covered by fibrous tissue, and that is known as the fontanelle, right? And a newborn has 6 fontanelles, anterior, posterior, 2 anterior lateral and 2 posterior lateral. So total 6 fontanelles are there in a newborn. And a layperson, he calls the anterior fontanelle, which is very prominent, it is also known as, they call it soft spot, right? And as soon as a child is born, so at that point, if you feel the sutures, so they're not far apart, because in the process of childbirth they come very close to each other, and sometimes they overlap each other, so they are felt as ridges in the newborn. And in the sutures there are pulsations often felt, and those are the pulsations of the cerebral arteries. And the clinical significance of these fontanelles is that sometimes they could be bulging, or sometimes they could be depressed. So if a fontanelle is bulging, it means the child was crying, or the intracranial pressure has increased. It increases in cases of infections like meningitis. And if the fontanelle is depressed, it indicates dehydration. The next clinical is the degenerative joint diseases. It is similar to what we have discussed in osteoarthritis from the Medes clinicals. It tells the same thing, that wear and tear happens with age, and some degree of wear and tear is normal. But when that escalates, so the cartilage, it just vanishes, and the two bones, they come in contact with each other, and it mostly occurs in the weight bearing joints of the body, right? And it causes discomfort and pain. The last is arthroscopy. I mentioned about this when we were discussing the meniscal injuries or meniscal tears. So here we take a telescope and we insert it in the synovial joint, and it goes into the synovial cavity, and that it's a surgical procedure. And via that, the surgeon is able to examine all the abnormalities which are present inside that cavity, inside that synovial cavity, and he can see the torn menisci or any collection in that joint. And you can also extract fluid, synovial fluid, via arthroscopy, and then you can examine that fluid. That is known as synovial fluid analysis. And you can also insert instruments via that puncture that you've made for the arthroscope, and that could be used for repairing any structures that you want to repair in that cavity. And this opening for the arthroscope is very small, and the procedure is very rapid, so this has replaced the traditional joint surgeries.